Phlebotomy Certification Exam CLIA Waived Testing Quiz. Question 1. In a routine phlebotomy scenario, which activity is commonly associated with CLIA waived point-of-care testing in the pediatric clinic during a final review? Option A. Reporting results without controls when controls are required. Option B. Using expired test strips because they look normal. Option C. Following manufacturer instructions and documenting quality control for a simple approved test. Option D. Changing the test procedure to save time. The correct answer is option C. Following manufacturer instructions and documenting quality control for a simple approved test. Waived testing is simple but still requires following instructions, QC, and documentation. Skipping required controls undermines result reliability. Expired strips may produce inaccurate results even if they look acceptable. Modifying the procedure can invalidate the test category and results. Question 2. Before performing a fingerstick glucose test, which step supports accurate point-of-care results in the long-term care unit during a study session? Option A. Skip patient identification because the device stores results. Option B. Apply disinfectant and test before the site dries. Option C. Use a strip from an unlabeled loose container. Option D. Confirm test strip expiration and run required quality control according to policy. The correct answer is option D. Confirm test strip expiration and run required quality control according to policy. Expiration checks and QC help ensure the device and strips are producing reliable results. Device storage does not replace identifying the patient. Testing before the site dries can contaminate or dilute the sample. Loose unlabeled strips may be expired or contaminated. Question 3. Why must abnormal point-of-care results be handled according to facility policy in the mobile collection site during a structured exam prep drill? Option A. Critical or unexpected results may require confirmation, documentation, or immediate notification. Option B. Only normal results belong in the medical record. Option C. The patient should interpret the result without staff involvement. Option D. Abnormal results should always be erased. The correct answer is option A. Critical or unexpected results may require confirmation, documentation, or immediate notification. Policies define how to verify, document, and communicate results that may affect patient care. Both normal and abnormal results may require documentation. Patients should receive appropriate clinical guidance rather than interpreting serious results alone. Erasing abnormal results hides clinically important information. Question 4. In the emergency department bay, which action should occur when a point-of-care glucose control result is out of range? Option A. Change the control value to the expected number. Option B. Do not report patient results until the problem is resolved according to policy. Option C. Use expired strips to compare. Option D. Continue testing patients because controls are optional. The correct answer is option B. Do not report patient results until the problem is resolved according to policy. Out-of-range controls suggest the system may not be reliable for patient testing. Changing QC values falsifies documentation. Expired strips add another source of unreliable results. Controls are required when policy or manufacturer instructions specify them. Question 5. After drawing a patient who takes anticoagulants, what post-puncture step is especially important while preparing a hemoglobin A1C specimen in the physician office lab? Option A. Ask the patient to bend the elbow sharply. Option B. Use the same bandage time for every patient without checking. Option C. Apply firm pressure longer and verify bleeding has stopped before bandaging. Option D. Skip pressure to avoid bruising. The correct answer is option C. Apply firm pressure longer and verify bleeding has stopped before bandaging. Patients on anticoagulants may bleed longer, so pressure and reassessment help prevent continued bleeding or bruising. Bending the elbow can promote bruising instead of controlled pressure. A fixed time without checking may miss ongoing bleeding. Skipping pressure increases bleeding risk. Question 6. To protect patient safety, which action helps prevent a hematoma after removing the needle in the community health screening event during a mock exam? Option A. Rub the puncture site to spread the blood. Option B. Remove the needle before releasing the tourniquet every time. Option C. Have the patient bend the elbow tightly. Option D. Apply clean gauze with firm pressure while the arm remains straight. The correct answer is option D. Apply clean gauze with firm pressure while the arm remains straight. Focused pressure with the arm straight helps seal the puncture site and limit bruising. Rubbing can disrupt clot formation and worsen bruising. The tourniquet should be released before needle removal to reduce pressure in the vein. Bending the elbow may increase leakage into tissue. Question 7. Bright red pulsating blood appears unexpectedly during a draw. Which concern should the phlebotomist consider while preparing a therapeutic drug level specimen in the preoperative testing area? Option A. Possible arterial puncture. Option B. Tube additive carryover. Option C. Normal capillary refill. Option D. Proper venous flow. The correct answer is option A. Possible arterial puncture. Pulsating bright red blood can indicate arterial access and requires stopping the procedure and applying pressure. Additive carryover affects specimen chemistry, not blood pulsation. Capillary refill is assessed in tissue color return, not tube blood flow. Typical venous flow is darker and not pulsatile. Question 8. When preparing for collection, which tube is collected first when blood cultures are ordered with other venipuncture tubes in the Oncology Infusion Center during a practice drill? Option A. Gray fluoride tube. Option B. Blood culture bottles or sterile culture tube. Option C. Serum separator tube. Option D. Lavender EDTA tube. The correct answer is option B. Blood culture bottles or sterile culture tube. Blood cultures are collected first to reduce contamination of the sterile specimen. Gray tubes are generally collected after other additive tubes. Serum separator tubes do not take priority over sterile blood culture collection. EDTA tubes are collected later to prevent additive carryover. Question 9. In the standard venipuncture order of draw, which tube usually follows blood cultures while preparing a ammonia specimen in the dialysis adjacent clinic? Option A. Gray fluoride tube. Option B. Royal blue tube for every test. Option C. Light blue sodium citrate tube. Option D. Lavender EDTA tube. The correct answer is option C. Light blue sodium citrate tube. The light blue citrate tube is collected early to protect coagulation testing from additive contamination. Gray fluoride tubes are usually near the end of the order. Royal blue tubes are used for specific trace element testing, not as the universal second tube. EDTA is collected later because it can interfere with coagulation and chemistry tests. Question 10. Before proceeding with the draw, which order is most appropriate for collecting blood cultures, light blue, serum, green, lavender, and gray tubes in the student skills lab during a competency review? Option A. Gray, lavender, green, serum, light blue, blood cultures. Option B. Serum, lavender, blood cultures, gray, light blue, green. Option C. Lavender, gray, green, serum, light blue, blood cultures. Option D. Blood cultures, light blue, serum, green, lavender, gray. The correct answer is option D. Blood cultures, light blue, serum, green, lavender, gray. The standard order minimizes additive carryover by collecting sterile cultures first, citrate early, then serum, heparin, EDTA, and glycolytic inhibitor tubes. Starting with gray places fluoride/oxalate before tubes that could be affected by carryover. Placing cultures after non-sterile tubes increases contamination risk. Starting with lavender risks EDTA contamination of later tubes. Question 11. Why does order of draw matter during evacuated tube collection while preparing a CBC specimen in the occupational health clinic? Option A. It helps prevent additive carryover from altering later specimens. Option B. It eliminates the need to mix tubes. Option C. It determines the patient's fasting status. Option D. It makes patient identification optional. The correct answer is option A. It helps prevent additive carryover from altering later specimens. Additives from one tube can contaminate another tube if collection order is incorrect. Additive tubes still need proper mixing after filling. Fasting status is based on patient preparation, not tube sequence. Patient identification is required regardless of tube order. Question 12. During capillary puncture, which specimen type is generally collected first when ordered while preparing a patient/INR specimen in the blood collection station? Option A. Gray top microtube. Option B. Blood gas specimen. Option C. Non-additive tube after all others. Option D. Serum specimen. The correct answer is option B. Blood gas specimen. Capillary specimens are collected in an order that protects tests most affected by clotting and air exposure, with blood gases first when required. Gray microtubes are collected after more time-sensitive capillary specimens. Non-additive tubes are not automatically collected first in capillary order. Serum is not first when blood gases are ordered. Question 13. For a basic metabolic panel collection, which capillary collection order is commonly used after blood gases when EDTA testing is ordered in the outpatient clinic during a structured exam prep drill? Option A. Gray microtube first even when blood gases are needed. Option B. Any order because capillary tubes have no additives. Option C. EDTA microtube before other additive and serum microtubes. Option D. Serum microtube before EDTA for every draw. The correct answer is option C. EDTA microtube before other additive and serum microtubes. EDTA microtubes are collected early in capillary collection to reduce clotting in hematology specimens. Blood gases are more time-sensitive and generally come first if ordered. Many capillary tubes contain additives, so order still matters. Serum first collection can allow clotting before the EDTA specimen is filled. Question 14. To protect patient safety, which tube is most appropriate for a routine CBC while preparing a blood culture specimen in the hospital unit during morning rounds? Option A. Gray sodium fluoride tube. Option B. Red no additive tube. Option C. Light blue sodium citrate tube. Option D. Lavender top tube containing EDTA. The correct answer is option D. Lavender top tube containing EDTA. EDTA preserves cellular morphology and prevents clotting for hematology testing such as CBC. Gray tubes are commonly used for glucose or lactate preservation. A red tube allows serum testing and is not the standard choice for CBC. Citrate is used mainly for coagulation testing. Question 15. After reviewing the order, which additive is found in a light blue tube used for patient and APTT testing while preparing a fasting glucose specimen in the urgent care laboratory? Option A. Sodium citrate. Option B. Sodium fluoride with potassium oxalate. Option C. Lithium heparin. Option D. EDTA. The correct answer is option A. Sodium citrate. Sodium citrate binds calcium in a controlled ratio so coagulation testing can be performed accurately. Fluoride/oxalate is used mainly to preserve glucose or lactate. Heparin is used for plasma chemistry tests rather than routine patient or APTT tubes. EDTA is used mainly for hematology and can interfere with coagulation testing. Question 16. When preparing for collection, which tube is commonly selected for many serum chemistry tests when gel separation is desired while preparing a type and screen specimen in the pediatric clinic? Option A. Light blue citrate tube. Option B. Serum separator tube with clot activator and gel. Option C. Gray fluoride tube only. Option D. Lavender EDTA tube. The correct answer is option B. Serum separator tube with clot activator and gel. A serum separator tube allows clotting and then separates serum from cells using gel after centrifugation. Citrate plasma is intended primarily for coagulation testing. Gray tubes preserve glucose but are not the general serum separator choice. EDTA plasma is not serum and can interfere with some chemistry tests. Question 17. In a routine phlebotomy scenario, which tube is commonly associated with heparinized plasma chemistry testing while preparing a lipid panel specimen in the long-term care unit? Option A. Light blue top tube. Option B. Pink top tube. Option C. Green top tube. Option D. Lavender top tube. The correct answer is option C. Green top tube. Green top tubes commonly contain heparin, which prevents clotting and provides plasma for chemistry testing. Light blue tubes contain citrate for coagulation testing. Pink tubes contain EDTA and are commonly used for blood bank testing. Lavender tubes contain EDTA for hematology. Question 18. Before proceeding with the draw, which tube is most commonly used for glucose preservation when testing may be delayed while preparing a troponin specimen in the mobile collection site? Option A. Light blue citrate tube. Option B. Blood culture bottle. Option C. Plain red tube only. Option D. Gray top tube with sodium fluoride and an anticoagulant. The correct answer is option D. Gray top tube with sodium fluoride and an anticoagulant. Sodium fluoride inhibits glycolysis, helping preserve glucose concentration before analysis. Citrate is used for coagulation studies, not routine glucose preservation. Blood culture bottles are for detecting microorganisms, not preserving glucose. A plain red tube does not contain glycolysis inhibitor. Question 19. During a scenario, which tube is commonly used for blood bank testing such as type and screen while preparing a thyroid panel specimen in the emergency department bay? Option A. Pink top EDTA tube. Option B. Light blue citrate tube. Option C. Green heparin tube for every blood bank test. Option D. Gray top fluoride tube. The correct answer is option A. Pink top EDTA tube. Pink top EDTA tubes are commonly used for blood bank specimens because they preserve cells and prevent clotting. Light blue citrate tubes are for coagulation testing. Green heparin tubes are not the routine tube for type and screen. Gray tubes are associated with glucose or lactate preservation. Question 20. In the physician office lab, which tube is generally collected for a blood culture specimen in the physician office lab during a competency review? Option A. Gray fluoride tube. Option B. Sterile blood culture bottle or SBS containing culture tube according to policy. Option C. SST after clotting. Option D. Lavender EDTA tube only. The correct answer is option B. Sterile blood culture bottle or SBS containing culture tube according to policy. Blood cultures require sterile collection into a culture system designed to support organism recovery. A gray tube preserves glucose and does not support blood culture protocols. An SST is for serum separation, not microorganism culture. A lavender tube is not designed as the primary blood culture container. Question 21. Why must a light blue citrate tube be filled to the proper level while preparing an electrolyte panel specimen in the community health screening event? Option A. EDTA needs extra room to mix. Option B. Serum cannot clot unless the tube is full. Option C. The blood to anticoagulant ratio must be correct for coagulation results. Option D. The tube color changes if underfilled. The correct answer is option C. The blood to anticoagulant ratio must be correct for coagulation results. Coagulation testing depends on a precise citrate to blood ratio, commonly described as 1 part citrate to 9 parts blood. EDTA is not the additive in a light blue citrate tube. Light blue tubes contain anticoagulant and are not collected to obtain serum clotting. Tube color does not change to warn of underfilling. Question 22. After collecting an additive tube, how should it usually be mixed while preparing a therapeutic drug level specimen in the preoperative testing area? Option A, leave it unmixed until centrifugation. Option B, open the stopper and stir with a wooden applicator. Option C, shake it hard until bubbles appear. Option D, gently invert the tube the recommended number of times. The correct answer is option D. Gently invert the tube the recommended number of times. Gentle inversion evenly distributes additive while reducing cell trauma. Failure to mix can allow clotting or poor additive action. Opening a tube risks exposure, contamination, and specimen loss. Vigorous shaking can cause hemolysis. Question 23. After reviewing the order, which problem can occur if a lavender EDTA tube is not mixed soon after filling while preparing a bilirubin specimen in the Oncology Infusion Center? Option A, microclots may form and make hematology results unreliable. Option B, the specimen turns into serum. Option C, the sodium citrate ratio improves. Option D, the tube becomes sterile for culture. The correct answer is option A. Microclots may form and make hematology results unreliable. EDTA must contact the blood promptly to prevent clot formation in hematology specimens. A lavender tube is intended for anticoagulated whole blood or plasma, not serum. Sodium citrate is not the additive in a lavender EDTA tube. Mixing does not create sterility for culture testing. Question 24. When preparing for collection, which practice helps reduce hemolysis during a routine ammonia collection in the dialysis-adjacent clinic during a clinical simulation? Option A, shake additive tubes vigorously. Option B, use appropriate needle size and gently invert tubes instead of shaking them. Option C, pull back a syringe plunger as hard as possible. Option D, force blood rapidly through a small needle. The correct answer is option B. Use appropriate needle size and gently invert tubes instead of shaking them. Gentle handling and appropriate equipment reduce red blood cell rupture. Vigorous shaking is a common cause of hemolysis. Excessive syringe force can rupture cells and compromise results. Forcing blood through a small needle can damage cells. Question 25. In a routine phlebotomy scenario, which laboratory result is especially affected by hemolysis because red cells release intracellular contents while preparing a lactate specimen in the student skills lab? Option A, tube expiration date is extended. Option B, tourniquet pressure becomes lower. Option C, potassium may be falsely increased. Option D, patient date of birth becomes invalid. The correct answer is option C. Potassium may be falsely increased. Hemolysis releases intracellular potassium from red blood cells and can falsely elevate measured potassium. A specimen problem cannot extend tube expiration. Tourniquet pressure is unrelated to the analyzer result after hemolysis. Patient demographics are not changed by cell rupture. Question 26. When using a syringe for blood transfer, which method best protects specimen quality while preparing a CBC specimen in the occupational health clinic? Option A, squirt blood through the needle into each tube. Option B, shake each tube hard to remove clots. Option C, remove the tube stopper and push blood in forcefully. Option D, use a safety transfer device and allow blood to flow gently into tubes. The correct answer is option D. Use a safety transfer device and allow blood to flow gently into tubes. A safety transfer device reduces needle stick risk and minimizes pressure-related cell damage. Pushing blood through a needle can cause hemolysis and Sharp's injury. Shaking tubes can rupture cells and worsen specimen quality. Removing stoppers increases exposure and contamination risk. Question 27. Why should alcohol be allowed to dry before puncture while preparing a patient/INR specimen in the blood collection station? Option A. Wet alcohol can cause stinging and may contribute to hemolysis or specimen contamination. Option B. Wet alcohol improves vein anchoring. Option C. Alcohol drying replaces tourniquet use. Option D. Dry alcohol makes the tube additive stronger. The correct answer is option A. Wet alcohol can cause stinging and may contribute to hemolysis or specimen contamination. Air drying supports proper antisepsis and prevents wet alcohol from entering the specimen path. Vein anchoring depends on hand technique, not wet alcohol. Tourniquet use is a separate step for vein distension. Drying does not change the chemical strength of tube additives. Question 28. In the outpatient clinic, which specimen often requires protection from light after collection in the outpatient clinic during a practice drill? Option A. Routine sodium citrate coagulation tube. Option B. bilirubin specimen. Option C. Blood culture bottle during incubation. Option D. CBC specimen for platelet count. The correct answer is option B. Bilirubin specimen. Bilirubin is light sensitive and may decrease if the specimen is exposed to light. Citrate coagulation specimens require correct fill and processing, not light protection as the key issue. Blood cultures require sterile handling and incubation, not wrapping for light protection as the primary step. CBC specimens require mixing and timely testing, not routine light protection for platelet count. Question 29. For a blood culture collection, which specimen commonly requires rapid transport on ice or chilled handling according to policy in the hospital unit during morning rounds during a scenario? Option A. Serum separator tube for a lipid panel after clotting only. Option B. Blood culture bottle placed in the freezer. Option C. Ammonia specimen. Option D. Routine CBC kept for the next day. The correct answer is option C. Ammonia specimen. Ammonia specimens are time-sensitive and commonly require chilling and prompt processing. A lipid panel does not share the same immediate chilled handling requirement as ammonia. Blood culture bottles should not be frozen because organisms must remain viable for detection. A routine CBC should not simply be held for the next day without stability guidance. Question 30. To protect patient safety, which action best maintains specimen integrity during transport to the laboratory while preparing a fasting glucose specimen in the urgent care laboratory? Option A. Centrifuge every tube immediately regardless of type. Option B. Place all blood specimens in direct sunlight. Option C. Store every specimen at room temperature overnight. Option D. Follow required time, temperature, light, and handling instructions for the ordered test. The correct answer is option D. Follow required time, temperature, light, and handling instructions for the ordered test. Different tests have specific stability requirements, so handling must match the test and facility policy. Some tubes should not be centrifuged immediately or at all before required steps. Sunlight can degrade light-sensitive analytes and warm specimens. Overnight room temperature storage can make many specimens unacceptable. Question 31. If a specimen must be transported cold, which approach is appropriate while preparing a type and screen specimen in the pediatric clinic? Option A. Place the specimen in the approved cooling method without direct water contamination. Option B. Hold it in a bare hand to keep it visible. Option C. Place it near a heater until pickup. Option D. Submerge the tube in loose ice water. The correct answer is option A. Place the specimen in the approved cooling method without direct water contamination. Cooling must preserve the required temperature while protecting the label and tube from contamination or leakage. Holding the specimen warms it and defeats the cold requirement. A heater can destabilize temperature-sensitive analytes. Loose ice water can damage labels and create contamination issues. Question 32. When preparing for collection, which situation is a common reason for specimen rejection while preparing a lipid panel specimen in the long-term care unit? Option A. Patient stated date of birth. Option B. Wrong tube type or insufficient specimen volume. Option C, tube was labeled at the bedside. Option D, collector wore gloves. The correct answer is option B. Wrong tube type or insufficient specimen volume. Wrong container choice or inadequate volume can prevent accurate testing and may require recollection. Patient-stated identifiers support accurate identification. Bedside labeling is the correct practice. Wearing gloves is expected when blood exposure is possible. Question 33. Why should tube expiration dates be checked before collection while preparing a troponin specimen in the mobile collection site? Option A, expired tubes prevent hemolysis in every case. Option B, expired tubes are required for coagulation testing. Option C, expired tubes may have inadequate vacuum or unreliable additive performance. Option D, expired tubes identify patients faster. The correct answer is option C. Expired tubes may have inadequate vacuum or unreliable additive performance. Tube vacuum and additive quality can decline after expiration, compromising specimen volume or test accuracy. No expired tube can guarantee hemolysis prevention. Coagulation testing requires properly filled, unexpired citrate tubes. Expiration dates do not help verify identity. Question 34. A patient scheduled for a fasting lipid panel says they ate breakfast. Which action is best while preparing a thyroid panel specimen in the emergency department bay? Option A, tell the patient not to mention the meal. Option B, cancel every test without notifying anyone. Option C, draw the specimen and write fasting on the label. Option D, follow facility policy by notifying the appropriate person and documenting or rescheduling as directed. The correct answer is option D. Follow facility policy by notifying the appropriate person and documenting or rescheduling as directed. Fasting status affects certain tests, so the discrepancy must be handled through policy and communication. Hiding the meal prevents proper interpretation of results. Canceling without communication may disrupt care and exceed the phlebotomist's role. Marking the specimen as fasting would be inaccurate documentation. Question 35. Why is fasting status important before some chemistry tests while preparing a hemoglobin A1C specimen in the physician office lab? Option A, food intake can alter analytes such as glucose or lipids. Option B, fasting makes needles sterile. Option C, fasting eliminates the need for tube mixing. Option D, food changes the patient's legal name. The correct answer is option A. Food intake can alter analytes such as glucose or lipids. Some blood values vary after eating, so fasting helps standardize interpretation. Sterility comes from equipment and technique, not fasting. Additive tubes still require proper mixing regardless of fasting status. Food intake does not affect patient identity. Question 36. For a medication trough level, when is the specimen usually collected while preparing an electrolyte panel specimen in the community health screening event? Option A. At any random time during the day. Option B, immediately before the next scheduled dose. Option C. Only after the medication is discontinued for a week. Option D, immediately after the medication is swallowed. The correct answer is option B. Immediately before the next scheduled dose. A trough measures the lowest drug concentration, typically just before the next dose. Random timing can make therapeutic drug results difficult to interpret. Stopping medication for a week is not the routine way to collect a trough. Immediately after dosing reflects absorption or peak timing, not trough. Question 37. During a glucose tolerance test, why must collection times be followed carefully while preparing a therapeutic drug level specimen in the preoperative testing area? Option A, timing only matters after the last tube. Option B. The patient should eat between timed draws to stay comfortable. Option C, timed results show how the body responds to a measured glucose dose. Option D. Any time is acceptable if the tubes are gray. The correct answer is option C. Timed results show how the body responds to a measured glucose dose. Glucose tolerance testing depends on comparing specimens at specific intervals after glucose administration. Every scheduled interval matters for interpretation. Eating during the test can invalidate the glucose response pattern. Tube type does not remove the need for precise timing. Question 38. To protect patient safety, which documentation is especially important for a timed specimen while preparing a bilirubin specimen in the Oncology Infusion Center? Option A. Only the patient's room number. Option B. A note saying collected sometime today. Option C. The phlebotomist's favorite tube brand. Option D. Exact collection time recorded on the label or requisition according to policy. The correct answer is option D. Exact collection time recorded on the label or requisition according to policy. Timed tests require accurate collection time so results can be interpreted correctly. Room number is not a valid substitute for collection time. Vague timing can make the specimen clinically unreliable. Tube brand does not communicate timing. Question 39. Before collecting blood cultures, why is careful skin antisepsis critical while preparing a ammonia specimen in the dialysis-adjacent clinic? Option A. It reduces contamination that could cause a false positive culture. Option B. It eliminates the need for sterile bottles. Option C. It changes venous blood into arterial blood. Option D. It makes EDTA tubes clot faster. The correct answer is option A. It reduces contamination that could cause a false positive culture. Blood cultures are highly sensitive to skin organisms, so antisepsis helps ensure organisms detected are clinically meaningful. Sterile collection containers are still required. Skin antisepsis does not change the type of blood collected. EDTA clotting is unrelated to culture site preparation. Question 40. When collecting blood cultures with other tubes, which priority is most important while preparing a lactate specimen in the student skills lab? Option A. Touch the bottle tops after cleaning to confirm dryness. Option B. Maintain sterility and collect cultures before non-sterile tubes. Option C. Use a non-sterile transfer cup. Option D. Collect cultures after gray tubes. The correct answer is option B. Maintain sterility and collect cultures before non-sterile tubes. Blood cultures must be protected from contamination because false positives can lead to unnecessary treatment. Touching clean tops can recontaminate them. A non-sterile transfer process defeats the purpose of sterile collection. Collecting cultures after other tubes increases contamination risk. Question 41. If using a winged set for blood cultures, why is bottle order guided by facility policy while preparing a CBC specimen in the occupational health clinic? Option A. The order prevents the need to clean the site. Option B. The order makes the needle reusable. Option C. Air in the tubing can affect which bottle should be filled first. Option D. The order determines the patient's identity. The correct answer is option C. Air in the tubing can affect which bottle should be filled first. Butterfly tubing contains air, and culture bottle order may be chosen to manage that air safely. Skin and bottle antisepsis are still required. Needles are single-use and cannot be reused. Bottle order does not verify patient identity. Question 42. For a legal blood alcohol collection, which requirement is especially important while preparing a patient/INR specimen in the blood collection station? Option A. Leave the specimen unlabeled until court. Option B. Let the patient carry the open tube to the lab. Option C. Use alcohol swabs for every blood alcohol specimen. Option D. Maintain chain of custody documentation and use the required non-alcohol antiseptic if specified. The correct answer is option D. Maintain chain of custody documentation and use the required non-alcohol antiseptic if specified. Legal specimens require strict identity, handling, and documentation controls to preserve admissibility and integrity. Unlabeled legal specimens break traceability. Allowing the patient to carry an open specimen compromises custody and security. Alcohol antiseptic may contaminate alcohol testing and may be prohibited by protocol. Question 43. During a structured exam prep drill, which action best supports chain of custody for a drug screen specimen while preparing a basic metabolic panel specimen in the outpatient clinic? Option A. Document each person who handles the specimen from collection to transfer. Option B. Store the specimen in an unlocked public area. Option C. Discard the seal after collection. Option D. Use only verbal handoff with no signatures. The correct answer is option A. Document each person who handles the specimen from collection to transfer. Chain of custody proves who had control of the specimen at each step. Unsecured storage can compromise specimen integrity. A broken or discarded seal weakens evidence of tamper control. Verbal handoff alone does not create a traceable legal record. Question 44. Why are tamper-evident seals used on forensic or workplace testing specimens while preparing a blood culture specimen in the hospital unit during morning rounds? Option A. They make refrigeration unnecessary for all tests. Option B. They help show whether the specimen was opened or altered after collection. Option C. They prevent the need for a requisition. Option D. They replace patient consent. The correct answer is option B. They help show whether the specimen was opened or altered after collection. Tamper-evident seals support specimen integrity by making unauthorized opening visible. Temperature requirements still depend on the test. A requisition or custody form is still needed for proper processing. A seal does not replace required consent or authorization. Question 45. For an infant heel stick, which area is safest for puncture while preparing a fasting glucose specimen in the urgent care laboratory? Option A. Center of the arch. Option B. Tip of the great toe. Option C. Medial or lateral plantar surface of the heel. Option D. Posterior curvature of the heel. The correct answer is option C. Medial or lateral plantar surface of the heel. The medial or lateral plantar heel avoids deeper structures when an appropriate lancet depth is used. The arch is not an approved heel stick site. The great toe is not the standard infant heel stick site. The posterior curvature increases risk of bone injury. Question 46. Why should an infant heel puncture not be too deep while preparing a type and screen specimen in the pediatric clinic? Option A. Depth determines the tube color. Option B. A deep puncture replaces the need for warming. Option C. A deeper puncture always prevents hemolysis. Option D. Excessive depth can injure bone or deeper tissue. The correct answer is option D. Excessive depth can injure bone or deeper tissue. Infants have small heels, and excessive lancet depth can damage underlying structures. Tube color is selected by test requirements, not puncture depth. Warming is a separate step used to improve blood flow when appropriate. Deeper puncture can increase injury and does not guarantee specimen quality. Question 47. After reviewing the order, which finger is generally preferred for adult capillary puncture while preparing a lipid panel specimen in the long-term care unit? Option A. Middle or ring finger on the palmar surface near the side of the fingertip. Option B. Index fingertip in all adults. Option C. Little finger near the bone. Option D. Thumb pad for every test. The correct answer is option A. Middle or ring finger on the palmar surface near the side of the fingertip. The middle or ring finger usually has adequate tissue and less callus than other fingers. The index finger is often more sensitive and calloused. The little finger has less tissue over bone and higher injury risk. The thumb may be more calloused and is not the routine first choice. Question 48. After a finger puncture, why is the first drop of blood commonly wiped away while preparing a troponin specimen in the mobile collection site? Option A. It proves the patient is fasting. Option B. It may contain tissue fluid or contaminants that can affect the specimen. Option C. It activates the tube vacuum. Option D. It contains only white blood cells. The correct answer is option B. It may contain tissue fluid or contaminants that can affect the specimen. The first drop can be diluted with tissue fluid or skin contaminants, so wiping it improves specimen quality for many tests. Fasting status cannot be determined from the first drop. Capillary collection does not depend on evacuated tube vacuum at the puncture site. The first drop is not composed only of white blood cells. Question 49. How can warming a capillary puncture site help collection while preparing a thyroid panel specimen in the emergency department bay? Option A. It removes the need to identify the patient. Option B. It makes every specimen suitable for culture. Option C. It increases local blood flow when used safely. Option D. It sterilizes the skin completely. The correct answer is option C. It increases local blood flow when used safely. Warmth can improve capillary blood flow and reduce the need for excessive squeezing. Patient identification is still mandatory. Capillary specimens are not automatically suitable for blood culture collection. Warming does not sterilize skin. Question 50. Why should excessive squeezing or milking be avoided during capillary collection while preparing a hemoglobin A1C specimen in the physician office lab? Option A. It makes EDTA unnecessary. Option B. It prevents clotting in serum tubes. Option C. It improves all glucose results. Option D. It can dilute the specimen with tissue fluid and cause hemolysis. The correct answer is option D. It can dilute the specimen with tissue fluid and cause hemolysis. Excessive pressure can alter specimen composition and damage cells. EDTA is still needed when an EDTA microtube is required. Serum tubes are intended to clot and are not protected by squeezing. Glucose results can be affected by poor specimen quality rather than improved. Question 51. When is dermal puncture commonly preferred over venipuncture while preparing an electrolyte panel specimen in the community health screening event? Option A. For some infants, small volume tests, or patients with difficult veins when appropriate. Option B. For all coagulation studies regardless of policy. Option C. Whenever patient identification is incomplete. Option D. For every blood culture set. The correct answer is option A. For some infants, small volume tests, or patients with difficult veins when appropriate. Dermal puncture can be useful when only small volumes are needed or venipuncture is difficult. Coagulation testing has strict specimen requirements and is not automatically dermal. Incomplete identification must be resolved before any collection method. Blood cultures usually require sterile venipuncture collection and adequate volume. Question 52. A child begins to pull away during a draw. Which action supports safety while preparing a therapeutic drug level specimen in the preoperative testing area? Option A. Scold the child until they stop. Option B. Pause if needed and obtain appropriate assistance for safe positioning according to policy. Option C. Ask another child to hold the arm. Option D. Continue while the arm is moving. The correct answer is option B. Pause if needed and obtain appropriate assistance for safe positioning according to policy. Safe positioning prevents sudden movement that could injure the child or phlebotomist. Scolding is not therapeutic and can escalate fear. Another child is not appropriate assistance for a procedure. Continuing while the arm moves increases injury risk. Question 53. For a bilirubin collection, which explanation is best for a young child before a fingerstick in the Oncology Infusion Center during a structured exam prep drill? Option A. Use detailed adult medical terminology. Option B. Promise a toy only if they do not cry. Option C. Use simple honest words such as a quick pinch and explain what they can do to help. Option D. Tell the child nothing will happen. The correct answer is option C. Use simple honest words such as a quick pinch and explain what they can do to help. Age-appropriate honesty helps the child understand and cooperate without unnecessary fear. Complex terminology can confuse or frighten a young child. Tying a reward to not crying can shame a normal fear response. Saying nothing will happen is misleading. Question 54. For an older adult with fragile veins, which technique is most appropriate while preparing a ammonia specimen in the dialysis-adjacent clinic? Option A. Use the largest needle available. Option B. Leave the tourniquet on for several minutes. Option C. Slap the site hard to make veins appear. Option D. Use gentle anchoring and consider a smaller needle or controlled collection device. The correct answer is option D. Use gentle anchoring and consider a smaller needle or controlled collection device. Fragile veins need careful stabilization and equipment that reduces trauma or collapse. A large needle can worsen trauma. Prolonged tourniquet time increases hemoconcentration and bruising risk. Slapping can injure delicate skin and is unprofessional. Question 55. Why should adhesive bandages be used carefully on some older adults while preparing a lactate specimen in the student skills lab? Option A. Fragile skin can tear when adhesive is removed. Option B. Older adults never need pressure after draws. Option C. Bandages prevent all anticoagulant bleeding. Option D. Adhesive changes the blood type. The correct answer is option A. Fragile skin can tear when adhesive is removed. Aging skin may be thin and easily damaged, so pressure wrap or gentle dressing choices may be needed. Older adults still need pressure until bleeding stops. A bandage does not eliminate bleeding risk, especially with anticoagulants. Adhesive has no effect on blood type. Question 56. Before assembling equipment for a CBC draw, which item should be checked while preparing a CBC specimen in the occupational health clinic? Option A. The patient's favorite beverage. Option B. Tube type, expiration date, needle safety device, and requisition requirements. Option C. The brand of wall clock in the room. Option D. Only the color of the chair. The correct answer is option B. Tube type, expiration date, needle safety device, and requisition requirements. Checking supplies before collection helps prevent wrong container use, expired tubes, and safety device problems. Favorite beverage is not part of collection equipment verification. The wall clock brand does not confirm correct supplies or orders. Chair color has no role in specimen acceptability. Question 57. In a routine phlebotomy scenario, which sequence is safest after blood has entered the final tube while preparing a patient/INR specimen in the blood collection station? Option A. Activate safety device before removing the needle from the arm. Option B. Remove the needle and recap it before pressure. Option C. Release tourniquet, remove tube, place gauze, withdraw needle, activate safety device, apply pressure. Option D. Withdraw needle with tourniquet tight and no gauze ready. The correct answer is option C. Release tourniquet, remove tube, place gauze, withdraw needle, activate safety device, apply pressure. The final steps should reduce venous pressure, prepare for bleeding control, and secure the sharp immediately. Most safety devices are activated after withdrawal unless the device instructions say otherwise. Recapping a contaminated needle creates sharp's injury risk. Withdrawing with the tourniquet tight can increase bleeding and bruising. Question 58. Before proceeding with the draw, which action should occur before leaving the patient after venipuncture while preparing a basic metabolic panel specimen in the outpatient clinic? Option A. Tell the patient to remove the bandage immediately. Option B. Dispose of sharps after walking to another room. Option C. Leave while blood is still oozing. Option D. Confirm bleeding has stopped and provide appropriate post-draw instructions. The correct answer is option D. Confirm bleeding has stopped and provide appropriate post-draw instructions. Post-draw assessment helps prevent bleeding, bruising, and delayed complications. Immediate bandage removal can restart bleeding. Sharps must be disposed of promptly in the collection area. Leaving active bleeding unattended is unsafe. Question 59. Why is patient positioning important before venipuncture while preparing a blood culture specimen in the hospital unit during morning rounds? Option A. It reduces the risk of falls or injury if the patient becomes dizzy. Option B. It changes EDTA into citrate. Option C. It allows the needle to be reused safely. Option D. It makes labeling unnecessary. The correct answer is option A. It reduces the risk of falls or injury if the patient becomes dizzy. A seated or lying position with arm support protects the patient if syncope occurs. Body position does not change tube additives. Needles are single-use and cannot be reused. Proper positioning does not replace specimen labeling. Question 60. In the urgent care laboratory, which patient instruction is appropriate after a routine venipuncture in the urgent care laboratory during a competency review? Option A. Remove the bandage while still bleeding. Option B. Keep pressure on the site and avoid heavy lifting with that arm for a short time if advised. Option C. Bend the elbow tightly for 10 minutes. Option D. Scratch the site if it feels itchy. The correct answer is option B. Keep pressure on the site and avoid heavy lifting with that arm for a short time if advised. Post-draw instructions support clot formation and reduce bruising or bleeding. Removing a bandage during bleeding can restart or worsen bleeding. Bending the elbow tightly can increase bruising. Scratching can disrupt the site and introduce contamination. Question 61. For a type and screen collection, which laboratory department commonly performs CBC testing in the pediatric clinic during a final review? Option A. Blood bank only. Option B. Histology only. Option C. Hematology. Option D. Microbiology only. The correct answer is option C. Hematology. Hematology evaluates blood cells and commonly performs CBC testing. Blood bank focuses on compatibility and transfusion-related testing. Histology focuses on tissue specimens rather than routine CBC testing. Microbiology focuses on organisms and cultures. Question 62. To protect patient safety, which department usually performs patient and APTT coagulation testing while preparing a lipid panel specimen in the long-term care unit? Option A. Microbiology culture bench only. Option B. Cytology screening only. Option C. Urinalysis only. Option D. Coagulation or hematology coagulation section. The correct answer is option D. Coagulation or hematology coagulation section. Coagulation testing evaluates clotting pathways and is commonly handled in a coagulation section. Microbiology culture benches identify organisms rather than routine clotting times. Cytology examines cells for diagnostic changes, not standard coagulation studies. Urinalysis focuses on urine specimens. Question 63. After reviewing the order, which department is most associated with blood cultures while preparing a troponin specimen in the mobile collection site? Option A. Microbiology. Option B. Histology tissue processing. Option C. Chemistry electrolyte analysis only. Option D. Blood bank compatibility only. The correct answer is option A. Microbiology. Microbiology processes cultures to detect and identify microorganisms. Histology processes tissue rather than blood culture bottles. Chemistry analyzes chemical constituents and is not the main culture department. Blood bank testing focuses on transfusion compatibility. Question 64. When preparing for collection, which department commonly performs type and screen testing while preparing a thyroid panel specimen in the emergency department bay? Option A. Chemistry only. Option B. Blood bank or transfusion services. Option C parasitology stool testing only. Option D microbiology only. The correct answer is option B. Blood bank or transfusion services. Blood bank testing supports transfusion safety by determining blood type and antibody screen results. Chemistry focuses on analytes such as glucose and electrolytes. Parasitology stool testing does not perform transfusion compatibility testing. Microbiology focuses on infectious organisms. Question 65. In a routine phlebotomy scenario, which department commonly analyzes electrolytes such as sodium and potassium in the physician office lab during a review? Option A blood bank compatibility bench. Option B cytogenetics only. Option C chemistry. Option D histology. The correct answer is option C. Chemistry. Chemistry measures dissolved analytes such as electrolytes, enzymes, hormones, and metabolites. Blood bank compatibility testing is not the routine electrolyte section. Cytogenetics focuses on chromosomes or genetic studies, not routine electrolytes. Histology focuses on tissues. Question 66. Before proceeding with the draw, which practice is part of phlebotomy quality assurance in the community health screening event during a mock exam? Option A changing tube labels after results are reported. Option B skipping competency checks for experienced staff. Option C ignoring mislabeled specimens if the patient is well known. Option D tracking specimen errors and using corrective action to prevent recurrence. The correct answer is option D. Tracking specimen errors and using corrective action to prevent recurrence. Quality assurance identifies errors and improves processes so patients receive reliable results. Changing labels after reporting hides errors and compromises traceability. Competency checks help maintain consistent safe practice for all staff. Familiarity with a patient does not make a mislabeled specimen acceptable. Question 67. Why are competency assessments important for phlebotomists while preparing a therapeutic drug level specimen in the preoperative testing area? Option A. They verify that staff can perform required skills safely and consistently. Option B. They allow staff to ignore order of draw. Option C. They are only for patients who complain. Option D. They replace all written procedures. The correct answer is option A. They verify that staff can perform required skills safely and consistently. Competency assessment supports safe patient care and consistent specimen quality. Order of draw remains important regardless of competency status. Competency is a proactive quality process, not only a reaction to complaints. Written procedures are still needed as standards for practice. Question 68. In the Oncology Infusion Center, which error should be reported through the facility's quality process in the Oncology Infusion Center during a practice drill? Option A. A tube is mixed according to instructions. Option B. A specimen collected in the wrong tube type. Option C. A needle safety device is activated after use. Option D. A patient correctly states their date of birth. The correct answer is option B. A specimen collected in the wrong tube type. Wrong tube collection can cause test cancellation or inaccurate results and should be tracked for improvement. Proper tube mixing supports quality. Activating a safety device after use is the intended safety behavior. Correct identity confirmation is expected practice, not an error. Question 69. For a ammonia collection, which blood component is primarily responsible for carrying oxygen? Option A platelet granules only. Option B tube separation gel. Option C hemoglobin inside red blood cells. Option D sodium citrate in plasma. The correct answer is option C. Hemoglobin inside red blood cells. Hemoglobin within red blood cells binds and transports oxygen throughout the body. Platelets help hemostasis but do not primarily transport oxygen. Separation gel is part of a tube system, not a blood component. Sodium citrate is a tube additive, not an oxygen carrier. Question 70. To protect patient safety, which blood component is most directly involved in forming the initial platelet plug in the student skills lab during a competency review? Option A, glucose molecules. Option B, chloride ions. Option C, albumin only. Option D, platelets. The correct answer is option D. Platelets. Platelets adhere and aggregate at injury sites to begin primary hemostasis. Glucose is an energy source, not a clotting cell fragment. Chloride is an electrolyte and does not form platelet plugs. Albumin helps maintain oncotic pressure and transport substances but is not the platelet plug. Question 71. After reviewing the order, which vessel type is normally used for routine venipuncture in the occupational health clinic during a final review? Option A, vein. Option B, lymphatic duct. Option C, tendon sheath. Option D, artery. The correct answer is option A. Vein. Veins are lower pressure vessels that are routinely accessed for diagnostic blood collection. Lymphatic ducts do not provide venous blood specimens. A tendon sheath is not a blood vessel and must be avoided. Arterial puncture is a different procedure and not routine venipuncture. Question 72. Why is the basilic vein approached with extra caution in the blood collection station during a study session? Option A. It always has a built-in tourniquet. Option B. It lies near nerves and arteries in the antecubital area. Option C. It cannot be palpated in any patient. Option D. It contains no venous blood. The correct answer is option B. It lies near nerves and arteries in the antecubital area. The basilic area has nearby structures that increase the consequence of poor needle placement. No vein has a built-in tourniquet. The vein may be palpable, but caution is still needed because of anatomy. The basilic vein does contain venous blood. Question 73. In a routine phlebotomy scenario, which term describes stopping bleeding after vessel injury in the outpatient clinic during a structured exam prep drill? Option A, glycolysis. Option B, hemoconcentration. Option C, hemostasis. Option D, hemolysis. The correct answer is option C. Hemostasis. Hemostasis is the process that stops bleeding through vascular response, platelets, and coagulation. Glycolysis is glucose metabolism by cells. Hemoconcentration is increased concentration of blood components from fluid shifts. Hemolysis is red cell rupture. Question 74. A clotted lavender tube is received for CBC testing. Why is recollection usually needed in the hospital unit during morning rounds during a clinical simulation? Option A, clots improve automated CBC accuracy. Option B, lavender tubes are supposed to clot before testing. Option C, clotting proves the patient was fasting. Option D, clots trap cells and make cell counts unreliable. The correct answer is option D. Clots trap cells and make cell counts unreliable. CBC testing requires a well-mixed anticoagulated specimen so cells remain evenly suspended. Clots can block analyzers or distort cell counts. Lavender tubes contain EDTA and should not clot when properly mixed and filled. Fasting status is unrelated to clot formation in an EDTA tube. Question 75. An underfilled light blue tube arrives for patient testing. What is the main concern in the urgent care laboratory during a review? Option A, excess citrate relative to blood may alter coagulation results. Option B. The tube will automatically refill in the lab. Option C. The patient's identity becomes verified. Option D. The specimen will become a blood culture. The correct answer is option A. Excess citrate relative to blood may alter coagulation results. Underfilling changes the anticoagulant to blood ratio and can make coagulation results inaccurate. Tubes do not refill after collection. Fill volume has no role in verifying identity. A citrate tube cannot become a blood culture bottle. Question 76. In the pediatric clinic, which additive can falsely increase potassium if carried into a chemistry tube? Option A, sodium fluoride without potassium. Option B, potassium EDTA. Option C, sterile culture broth only. Option D, clot activator gel only. The correct answer is option B, potassium EDTA. Potassium EDTA carryover can contaminate chemistry specimens and falsely elevate potassium while lowering calcium. Sodium fluoride is associated with glucose preservation, not potassium EDTA effects. Culture broth is used for organism recovery and is not the classic potassium carryover problem. Gel itself does not add potassium in the same way EDTA contamination does. Question 77. For a lipid panel collection, which tube should generally be collected before a lavender EDTA tube in venipuncture order? Option A. Another lavender tube for every test. Option B. No tube because EDTA always comes first. Option C, green heparin tube. Option D, gray fluoride tube after lavender only. The correct answer is option C, green heparin tube. In the standard sequence, heparin tubes are collected before EDTA tubes to limit additive carryover effects. Collecting another lavender tube does not answer the order requirement. EDTA does not always come first and can interfere with later tests. Gray tubes generally follow EDTA, not precede it as the key before lavender tube. Question 78. To protect patient safety, which instruction is commonly given for a fasting blood test unless policy says otherwise in the mobile collection site during a practice drill? Option A, chew gum with sugar during the fast. Option B, eat a small snack because it will not matter. Option C, drink sugary beverages before arrival. Option D, avoid food and most beverages except water for the required fasting period. The correct answer is option D. Avoid food and most beverages except water for the required fasting period. Fasting helps standardize results for tests affected by recent food intake. Sugared gum can break the fast for some testing instructions. A snack can invalidate fasting status for tests that require it. Sugary beverages can alter glucose and other chemistry results. Question 79. If a timed specimen is collected late, which action is most appropriate in the emergency department bay during a scenario? Option A, document the actual collection time and notify the appropriate person according to policy. Option B, discard the requisition without telling anyone. Option C, change the patient's medication schedule independently. Option D, write the scheduled time on the label anyway. The correct answer is option A. Document the actual collection time and notify the appropriate person according to policy. Actual collection time is necessary to interpret timed results and decide whether recollection is needed. Discarding the order without communication disrupts care. Medication timing decisions are outside routine phlebotomy authority. Writing the scheduled time is inaccurate documentation. Question 80. When preparing for collection, which action increases the chance of blood culture contamination in the physician office lab during a competency review? Option A. Using sterile culture bottles. Option B, replicating the cleansed site with an unclean glove before needle insertion. Option C, collecting cultures before other tubes. Option D, allowing antiseptic to dry. The correct answer is option B. Replicating the cleansed site with an unclean glove before needle insertion. Touching the disinfected site with an unclean glove can reintroduce skin organisms. Sterile bottles help maintain specimen integrity. Collecting cultures first helps reduce contamination from other tubes. Allowing antiseptic to dry supports effective skin preparation. Question 81. In a routine phlebotomy scenario, which behavior is outside appropriate phlebotomy scope in a routine collection setting in the community health screening event during a final review? Option A, labeling the specimen at the bedside. Option B. Reporting a specimen problem to the supervisor. Option C. Interpreting the diagnosis and changing the provider's order independently. Option D. Verifying patient identity. The correct answer is option C. Interpreting the diagnosis and changing the provider's order independently. Phlebotomists collect and handle specimens but do not independently diagnose or alter provider orders. Bedside labeling is expected practice. Reporting problems supports patient safety and quality assurance. Identity verification is a core phlebotomy responsibility. Question 82. A patient asks when results will be ready. Which response is most appropriate in the preoperative testing area during a study session? Option A. Promise exact results in 5 minutes for every test. Option B. Tell the patient results are not their concern. Option C. Guess a diagnosis from the tube color. Option D. Explain that the laboratory or provider will report results according to facility process. The correct answer is option D. Explain that the laboratory or provider will report results according to facility process. The phlebotomist can provide general process information without interpreting or promising results outside their role. Turnaround time varies by test and setting, so a universal promise is unsafe. Dismissive language is unprofessional and does not support patient-centered care. Tube color does not allow diagnosis. Question 83. During a structured exam prep drill, which disposal choice is correct for blood-soaked gauze after a draw in the Oncology Infusion Center during a structured exam prep drill? Option A. Place it in the appropriate biohazard waste container according to policy. Option B. Put it in a clean supply drawer. Option C. Hand it to the next patient to hold. Option D. Place it in the sharps container. The correct answer is option A. Place it in the appropriate biohazard waste container according to policy. Blood-contaminated soft waste belongs in the designated biohazard stream when required by policy. A supply drawer must remain clean and uncontaminated. Giving contaminated gauze to another patient creates exposure risk. Sharps containers are reserved for needles and other sharps, not soft gauze. Question 84. In the dialysis-adjacent clinic, which item should never be stored with clean blood collection supplies? Option A. Unexpired evacuated tubes. Option B. Used needles or blood-contaminated materials. Option C. Clean tourniquets ready for use. Option D. Unopened sterile needles. The correct answer is option B. Used needles or blood-contaminated materials. Clean supplies must be protected from contamination to prevent patient exposure and specimen problems. Unexpired tubes belong with clean collection inventory. Clean tourniquets can be stored for patient use if facility policy permits. Unopened sterile needles are appropriate clean supplies when stored correctly. Question 85. Why should a phlebotomist follow the facility procedure manual rather than personal shortcuts in the student skills lab during a review? Option A. Procedure manuals are only for new employees. Option B. Regulations do not apply to outpatient settings. Option C. Standard procedures support consistent safety, quality, and regulatory compliance. Option D. Shortcuts are always faster and safer. The correct answer is option C. Standard procedures support consistent safety, quality, and regulatory compliance. Written procedures create a consistent standard that reduces variation and errors. Experienced staff are also expected to follow current procedures. Regulatory and safety expectations apply across collection settings. Shortcuts can bypass safety checks and increase risk. Question 86. To protect patient safety, which action helps prevent leakage during specimen transport in the occupational health clinic during a mock exam? Option A. Carry open tubes by hand. Option B. Place tubes loose in a coat pocket. Option C. Loosen the stopper to release pressure. Option D. Ensure the tube is closed securely and placed in approved transport packaging. The correct answer is option D. Ensure the tube is closed securely and placed in approved transport packaging. Secure closure and proper packaging protects staff, couriers, and specimen integrity. Open tubes increase spill and contamination risk. A coat pocket is not approved specimen transport packaging. Loosening the stopper can cause leaks and exposure. Question 87. A serum tube and lavender tube are ordered after blood cultures and citrate, which should be collected first in the blood collection station during a skills check. Option A, serum tube before lavender tube. Option B, gray before both in every case. Option C, order does not matter if both are mixed. Option D, lavender before serum. The correct answer is option A. Serum tube before lavender tube. Serum tubes are collected before EDTA tubes to reduce EDTA carryover into chemistry specimens. Gray tubes are generally later in the order and are not automatically before serum. Mixing tubes does not correct additive carryover. Lavender first can contaminate the serum tube with EDTA. Question 88. When preparing for collection, which tube is most associated with ESR testing in many phlebotomy settings in the outpatient clinic during a practice drill? Option A, gray fluoride tube for every ESR. Option B, lavender EDTA tube or designated black citrate tube depending on method. Option C, SST for all ESR methods. Option D, blood culture bottle only. The correct answer is option B. Lavender EDTA tube or designated black citrate tube depending on method. ESR collection depends on the facility method, commonly EDTA or a designated citrate ESR tube. Gray fluoride tubes are not the usual universal ESR container. SST serum is not appropriate for all ESR methods because ESR evaluates cellular settling. Blood culture bottles are for microbiology cultures. Question 89. Why should serum tubes be allowed to clot before centrifugation unless policy states otherwise in the hospital unit during morning rounds during a scenario? Option A. Early centrifugation improves blood culture growth. Option B, serum tubes contain no blood cells. Option C, centrifuging too early can leave fibrin strands and compromise serum quality. Option D, clotting makes EDTA work faster. The correct answer is option C. Centrifuging too early can leave fibrin strands and compromise serum quality. Serum specimens need adequate clot formation so serum separates cleanly after centrifugation. Blood culture growth is unrelated to serum tube clotting. Serum tubes initially contain whole blood cells before clotting and separation. EDTA is not the additive in a serum tube. Question 90. Before proceeding with the draw, which tube should not be centrifuged before it has clotted when serum is required in the urgent care laboratory during a competency review? Option A, light blue citrate tube for patient. Option B, gray fluoride tube for glucose. Option C, lavender EDTA tube for CBC. Option D, red top or serum separator tube. The correct answer is option D. Red top or serum separator tube. Serum tubes must clot before centrifugation to obtain clear serum and avoid fibrin problems. Light blue specimens are anticoagulated plasma for coagulation testing. Gray specimens contain additives for glucose preservation and are not serum clot tubes. Lavender CBC specimens are whole blood and are not clotted for serum. Question 91. During a final review, which action is appropriate if a patient has a latex allergy in the pediatric clinic during a final review? Option A, use latex-free equipment and follow facility allergy precautions. Option B, ignore the allergy if gloves are powder-free. Option C, ask the patient to hold the latex tourniquet away from the skin. Option D, use latex equipment briefly because exposure is short. The correct answer is option A. Use latex-free equipment and follow facility allergy precautions. Latex-sensitive patients require latex-free supplies to prevent allergic reactions. Powder-free latex may still contain latex proteins. Having the patient hold latex does not remove exposure risk. Short exposure can still trigger a reaction. Question 92. In the long-term care unit, which mismatch requires resolution before drawing blood? Option A. The collection tray has extra gauze. Option B. The requisition name does not match the patient's wristband. Option C. The phlebotomist has 2 tube holders. Option D. The patient is wearing a sweater. The correct answer is option B. The requisition name does not match the patient's wristband. An identity mismatch can lead to a wrong patient specimen and must be corrected before collection. Extra gauze does not affect patient identity. Having additional clean equipment does not create a patient mismatch. Clothing choice does not create an identification conflict. Question 93. During downtime when barcode labels are unavailable, what should guide specimen labeling in the mobile collection site during a structured exam prep drill? Option A. Labels borrowed from another patient. Option B. Memory of the patient after the shift. Option C. Approved manual identification and labeling procedure. Option D. No labels until the computer returns. The correct answer is option C. Approved manual identification and labeling procedure. Downtime procedures are designed to maintain traceability when electronic systems are unavailable. Borrowed labels cause wrong patient errors. Memory after the shift is not a reliable labeling method. Unlabeled specimens are unsafe and may be rejected. Question 94. To protect patient safety, which action reduces sharps injury risk immediately after withdrawing the needle in the emergency department bay during a clinical simulation? Option A. Set the exposed needle on the bed. Option B. Hand the exposed needle to a coworker. Option C. Carry the exposed needle to the lab. Option D. Activate the safety feature as designed and dispose of the device promptly. The correct answer is option D. Activate the safety feature as designed and dispose of the device promptly. Safety activation and prompt disposal isolate the sharp before it injures someone. A bed is not a safe surface for a contaminated sharp. Passing an exposed needle puts the coworker at risk. Carrying an exposed needle increases injury risk during transport. Question 95. Why should reusable tourniquets be cleaned or replaced according to policy in the physician office lab during a review? Option A. They can become contaminated between patients. Option B. They make citrate tubes underfill. Option C. They replace the need for gloves. Option D. They change venous blood into serum. The correct answer is option A. They can become contaminated between patients. Tourniquets contact patient skin and the environment, so cleaning or single patient use prevents cross-contamination. Citrate tube fill depends on collection volume and vacuum, not tourniquet cleaning. Gloves are still needed when blood exposure is possible. A tourniquet does not determine whether blood becomes serum. Question 96. When preparing for collection, which action helps keep a cleaned venipuncture site uncontaminated in the community health screening event during a mock exam? Option A. Place the used alcohol pad back on the site. Option B. Do not touch the site again unless repulpating with a sterile or policy-approved method. Option C. Scratch the site to improve blood flow. Option D. Fan the site with the requisition. The correct answer is option B. Do not touch the site again unless repulpating with a sterile or policy-approved method. Avoiding recontamination preserves the effect of skin antisepsis before puncture. A used alcohol pad is contaminated after use. Scratching damages skin and contaminates the puncture area. Fanning with paperwork can introduce contaminants. Question 97. In a routine phlebotomy scenario, which situation requires immediate cleanup or removal from the draw area in the preoperative testing area during a skills check? Option A. A printed order in the correct patient's chart. Option B. A clean unopened gauze packet. Option C. A contaminated needle holder or blood on the work surface. Option D. A sealed sterile needle in its package. The correct answer is option C. A contaminated needle holder or blood on the work surface. Contaminated surfaces and equipment can expose staff and patients to blood-borne pathogens. A correctly placed order does not create a contamination hazard. Clean unopened gauze is appropriate collection supply. A sealed sterile needle package is clean until opened. Question 98. Before proceeding with the draw, which documentation habit is most defensible after an unsuccessful draw attempt in the Oncology Infusion Center during a practice drill? Option A. Chart that the patient refused even if they did not. Option B. Blame the patient in informal language. Option C. Erase the attempt because no specimen was obtained. Option D. Record the attempt and outcome according to facility policy. The correct answer is option D. Record the attempt and outcome according to facility policy. Accurate documentation creates a truthful record and supports continuity of care. False refusal documentation is unethical and inaccurate. Informal blame language is unprofessional and not objective. Deleting the attempt hides relevant clinical information. Question 99. How many venipuncture attempts should a phlebotomist make before seeking help in the dialysis adjacent clinic during a scenario? Option A. Follow facility policy, commonly limiting attempts before asking another qualified person. Option B. 10 attempts before reporting difficulty. Option C. No limit when tubes are urgent. Option D. Unlimited attempts if the patient is quiet. The correct answer is option A. Follow facility policy, commonly limiting attempts before asking another qualified person. Attempt limits protect patients from unnecessary pain, bruising, and complications. 10 attempts is excessive for routine phlebotomy. Urgency does not eliminate safety limits or escalation procedures. A quiet patient may still be harmed by repeated attempts. Question 100. A fasting patient asks whether water is usually allowed. How should the phlebotomist respond in the student skills lab during a competency review? Option A. Encourage juice because it keeps veins full. Option B. Explain that water is commonly allowed unless the specific instructions or provider say otherwise. Option C. Say hydration never affects blood draws. Option D. Tell the patient water always ruins every test. The correct answer is option B. Explain that water is commonly allowed unless the specific instructions or provider say otherwise. Water is often permitted during fasting and can support hydration, but the exact instruction depends on the ordered test and policy. Juice contains sugar and can affect fasting analytes. Hydration can affect vein access, so it is not irrelevant. Water does not automatically ruin fasting laboratory tests.